today Dr. Anjana Thadani ma'am. She's a consultant developmental pediatrician, and she's there with Learning Disability Clinic with KEM as well, and she's a director of Niramaya Hospital and the Guidance Clinic. She's a national chairperson, Growth and Development and Behavioral Pediatrics chapter of IAP. She's a director of PEHEL Services. It's a non-profit NGO mainly for special needs, education and medical services. And as a IAP module, she is there on growth monitoring, developmental delay, autism, child rights and child protection, cradle to crayon and beyond, basics of behavior. She has contributed as a research publications and articles in chapters in learning disability, child abuse, development and behavior as well. She's a joint secretary of IMA Chembur, Mumbai. So welcome ma'am, welcome for the webinar.
Thank you. So I think I guess I'll take it from here. Am I audible to everyone?
Yeah, you are.
Yes, ma'am, you are.
So you would be changing the slides, right? So can I say next?
Yes, ma'am. You can.
Yes.
Yeah.
Yes, so the whole topic today is we are talking of the situation which is because of the lockdown for the children with special needs, and that is something, one segment which is really suffering in this entire thing. Of course, now we are getting back on track with some services. However, it's not 100%. Next slide, please. See, COVID-19 brought a lot of new challenges and terminology, and it's something which is across the globe because it's a pandemic. That we learned these terms very quickly: lockdown, social distancing, it's all become the new norm. But what happens is it is difficult for our children with developmental disabilities, especially autism, to learn the new terms, to accept the new terms. However, the only positive thing of this entire pandemic, I would say, is that everybody has suddenly been motivated to move towards technology for solutions, especially for children with regards to consultation and therapies. Because though in this pandemic, children are not really that badly affected. Most of the children have milder symptoms and they recover well. They don't go through that entire cycle of COVID pneumonia and cytokine storms and all that. But everybody has a lot of fear psychosis to get the children out of the house and go for offline therapy. So this is the only positive thing I would say about, when we are talking about people changes which have happened in COVID situation. Next one. Now the stressor is not only for children, the stressor is for everyone. Every family is bothered about the financial situation at home. Fear of getting COVID in the family. You have vulnerable population in the form of every family, children as well as the elderly with comorbidities. So there's a lot of fear, there's a lot of anxiety in the population as such. Besides this, there are changes in the sleep and eating pattern. Now this is an hallmark which we used to think for behavioral problem in children. This is one of the red flag signs which I would tell most of the parents, that if the child shows any of these things, but here this is a pattern which is seen globally. People are watching stuff till late night. The sleep awake cycle has completely shifted. Difficulty sleeping and concentrating on things is something, and this is also the people who are working from home, professional, they are struggling with that. And also children are not able to concentrate on therapies and solutions. Worsening of chronic health conditions, yes, and the mental health issues. So a lot of mental health issues. So you see people who are very anxious, you see people, so many suicides are happening around. Of course, I don't want to talk about that, but generally, and the people who have existing mental health issues are also deteriorating. Children with chronic health issues, I have heard so many cases wherein they were epileptic children are come back to the breakthrough convulsions, not getting the medicines properly, not sleeping well, not taking medicines on time. So a lot of issues are happening. Another thing is the alcohol abuse and tobacco and drug abuse and domestic violence and child abuse. Now these things are again which have increased during the COVID period. Next one. Now the current scenario, when we look at it, so everybody is worried. I told what are the challenges which are generally felt. Everybody is stressed. They're aware of the problem. With children, and especially the children with developmental disabilities, people are not, they don't know how to express their feelings. So there are a lot of new things they don't really understand. We're not able to provide them the information in the way it should be provided. And so the children with autism are, and the families basically, see, children are not that aware. when we look at it. They just express themselves in different ways. However, the families are really struggling in COVID because they are not able to express their, anxieties appropriately, the fears appropriately. And I'll discuss in the next few slides that how do they actually present. Next one. Next slide, please. Okay. Now, what is happening to children? One, it's believe me, what I'm seeing in last, of course, during the lockdown, the first month, I think all of us just sat at home and did nothing about it. The second month, second half of April is the time when we started seeing a lot of behavioral problem in children. So it's the psychosocial, impact has been much more. With children, the challenges are that their access to socialization is completely disrupted. There's no playtime, they don't go out. Physical contact has also decreased among people. This I see more in the people who are providing emergency services, like doctors. We as doctors are not really cuddling our children. We're talking of normal children, we're talking of children, and some people, professionals, also have children with special needs. So we are maintaining that physical distance. School closures with poor access to learning. Of course, now the schools have all started, but they are online schools. So there's a limited interaction which is happening. Children are feeling very confused, very anxious. There's a lot of overexposure to, mass and social media, especially more in the little older children as well as adolescents. Believe me, they have reached even a point of saturation. There are children who were playing PUBG across the building with friends. They've stopped doing it. Not because we are planning to, discontinue that app per se. Generally, because they've all reached a point of saturation. And another point, which is, see, as adults, we understand the situation. We have access to information. Children don't really understand, especially the children with developmental disabilities, really do not understand the situation the way we understand it. So then there's a lot more confusion and frustration in them. Next one. What is happening to parents in the time? I'm talking of now all those general stresses I'm not talking of. One, because of their stresses, what is happening is their entire routine has gotten disrupted. Now, the children who are going to a play school, going to a special school, I'm talking of developmental disabled children. Now, the children with autism, the children with ADHD, the children with any physical disability, the children with other sensory impairments, when they were actually, they had a routine. They would go to the school, they would go to either a special school or a therapy center, come back, the parents would conduct sessions, then they may have some private sessions. All of that is completely disrupted. Because of so much of stress, financial stress, and otherwise also, parents, I feel, are not really very keen on engaging with the children as they were doing it earlier, pre-pandemic, if I have to talk about. And children are noticing all of this. And another thing what I feel is that they're noticing all of this, they're reacting in very heightened way to all this stress which is happening around them. Next. Now, before we move on to autism, which I'm sure Dr. Vadkar is going to speak much more in detail, the point I want to put across here is autism is a developmental disorder. Now, here the problem is mainly in 2-3 domains. One is language, speech delay, communication, and certain behaviors, which could be motor behaviors or sensory behaviors. Now, these are the children who are prone. So they have these behaviors as a hallmark of autism. What is happening is, and with all this change, disruption in the routine, most of the children with autism have something like a fixation, so they have difficulty with changes, with adaptability. So what is happening here is so many changes happening. Imagine a child is going to a school, meeting certain teachers, everything is set for the child. Suddenly the child cannot go out, sitting in the house, parents are in the house all the time, and the help is disrupted, cannot see the therapist. So a lot of changes are happening, and this is what is getting aggravated. I have seen children coming up with severe behavioral issues, screaming behavior, hitting behavior, self-injurious behavior. Spitting is something which is very commonly, the children, if they're very frustrated, they would start spitting. So spitting behavior is something which is seen, very commonly with children. And so this is what we are seeing, a lot of behavioral changes, even also coming up of certain stereotypies. Next. Now, when we look at autism, the reason why we are discussing exclusively in autism, because autism besides being a very unique disorder, every child is different. I mean, I'm sure Dr. Bhatkar would agree, but we have seen children with autism for last 2 decades. In last 20 years, I cannot say there are two children with autism who are exactly the same. You know, the children who are in the same family have had the misfortune of having two families wherein both the children were autistic. Even those two children were so different in their presentation, you know, because it's a spectrum presentation. And there are so many comorbidities. You'll have cognitive comorbidities, behavioral comorbidities, you know, genetic element is there, some amount of medical comorbidities. So it is a very unique and a complex situation. And every child has to be dealt with very specifically, taking into consideration what is his presentation and what are his symptoms. Next. When we're looking at red flag signs in children, generally what you would see children coming out with a lot of these symptoms. Difficulty in sleeping, nightmares is something we've seen children coming up. A lot of behavioral problems, especially I'm seeing children who have autism with ADHD, children only with ADHD, or smaller children, you know, or they're usually coming up with very disruptive behaviors and ODD features as well. Some children may have severe anxiety and fears, and they have clinging behaviors. So again, sensory would come up in some children, and decreased interest in playing, screen addiction, and then again, a lot of crying spells is something, another thing which children have presented with. Next one. Next slide, please. Yeah. When we're looking at children with autism, I think autism is missing here. One is another, too much of aggression. Sensory issues, the children have a lot of hugging, kissing behaviors, a lot of hitting behaviors, of course, part of aggression. Another children that, the children who were eating properly earlier have started, rejecting food. So a lot of neophagia has again appeared. Chewing problems, children become showing hypersensitivity to auditory stimulus and visual. So those are another some things which we've seen. Repetitive behavior, I have seen children 10 years old come up back with hand flapping. The hand flapping, typically you would see autistic children having hand flapping like this, or, spinning behavior or moving around. So those kind of behaviors which had completely gone in some children have come up. Another interesting point I want to add here, my consultation during this lockdown time, 70 to 80% have been children with ADHD and autism. And we've diagnosed a lot of new cases. Maybe I would say it's not that the lockdown has increased autism. What has happened is that the parents, working parents especially, have started critically looking at these younger children and started, working on them. However, some children have also improved because the parents could contribute a lot more towards therapy. Emotional disturbances and crying spells is something, again, new behaviors coming up. New behaviors. Now see, we have to understand that the children, when they are under any kind of stress, would usually present with aggression, especially autistic children, motor stereotypies, aggression, and sometimes sensory issues. So those are the things which we are seeing very common. Another reason which could be responsible for this is that their therapies have all been completely disrupted for 2 to 3 months. Most of us got back on therapy around the end of April, and still it's not 100% of people getting into therapy. Now, parental support, what is important is the parents need to understand the behavior and its cause. If you understand the cause and you understand the behavior, a lot of work can be done from the parental end itself, along with some professional support. You could tell them positive ways to express feelings, so you could, parents have to be taught how they could tell them to vent out their feelings without being disruptive. So if we use a lot of, placards, we use a lot of smileys, we use a lot of signages for the children, picture cards and all, wherein the children can learn to express. So they have some kind of emotional, vocabulary, it could be increased. And they're shown that this is how you're feeling, this is how you can express, and especially works more with non-verbal kids. Continuation of therapy is very, very important. Counseling support is more for autistic, especially younger autistic children. Counseling support is more for the parents to be able to cope up rather than for children. Small children really don't sit across for online therapies because we are not able to give too much of, tactile and other stimulus out there. However, work is mainly done with the parents. So it's a lot of observation. It's a lot of home program based therapy which could be given to these children. And if somebody is sick in the family, then and so in that time we have to anticipate an added anxiety in these children and worsening of behaviors, right? So once we anticipate it, we proactively the parent could start looking towards it and providing support. I think that's up for me, and I would request now Dr. Vadkar to take over. Thank you, everyone.
Thank you, ma'am.
Thank
Thank you
you.
very much for your valuable insights.
So this was a pretty good starter to say that what is the current status of autism and all the autistic kids that is going on currently with which we are experiencing. So as we are moving through this COVID, we are realizing that all the routine therapy sessions have been, most of the children, those therapy sessions have been blocked. Then the parents are there at home, and it's hats off to the therapist that parents are realizing that the patience that is required to sit with a kid with autism, to manage his all the needs, his whims, and all his way he wants to behave, and to still maintain our cool and let the child do his thing and modify his behavior as we require. So it's a challenging job for parents, and parents should understand that there is no other option, because it's not a day's time that autism, the COVID will come and we go. The COVID will be with us for at least few months, and then we cannot compromise any therapy for these few months, because that will be a huge stake that we are putting, and that may disturb the behavior of the child to a severe extent. So just a small introduction, as madam had explained. So what is autism? What is autism spectrum disorder? So autism spectrum is the general term for complex disorder of brain development. So DSM-5, a diagnostic manual, has put lots of previously called as autistic feature kids into a single umbrella of autism spectrum disorder. So there is an intellectual disability, some motor incoordination, attention and physical issues, sleep, gastrointestinal, and all these autistic disorder, Asperger, PDD, childhood disintegrative disorder, which were initially under different heads, have now all been now classified under a single umbrella. Lots of different things coming in. So primary being social impairment, speech, communication, and repetitive behavior. Now in this repetitive behaviors means they like sameness. So if they're walking on the same path, they like that path. If they're sitting in the same corner of the house, so at the same seat, they like the same seat, same toys. So the sameness is very important. Why is it important and how does it? Because the memory. So the memory processing, whenever we see something, we feel the things with our senses. So we look with our eyes, we hear with our ears, we feel, and then our brain captures those sensory input, it modifies them, puts part of it into long term, part of it to short term, and then based on that integration, we are able to behave whatever we are behaving. But in the case of autism, there is a difference in this whole memory processing unit, because of which they are not able to process as a normal individual with primarily language, face recognition, socialization. So these things are primarily affected. So it is caused because of the problems in early brain development. The symptoms are usually between 2 to 3 years of age. Attention to eyes is present, but they have found that as early as 6 months, they find the child is not focusing on the face. And then between 14 to 24 months, we can detect early ASD and start the early intervention that is required. With the recent data coming in, more and more prevalence of autism, more and more incidence of autism has increased, and this is the CDC in USA, where they are found that it has almost increased to 1 into 54. And such a high incidence primarily is because what they say to be is with some amount of genetic predisposition, there are lots of environmental factors that are changing. So more screen time and sleep disturbances, digital media, industrialization. So lots of things are coming in. but exact no one has been able to pinpoint which of these things. But one thing is definite, the genetics with the epigenetic. So epigenetic factors like all these environmental factors modifying the underlying genetic structure giving rise to autism. So as we are aware, so it is tenfold increase. Boys have 4 to 5 times more common than girls. In India, there are various studies in different parts which are still showing that the incidence is somewhere around 15 to 23 per 10,000. Global prevalence being 62 per 10,000. So as I described, many factors that interplay in the what way the autism is developed. So diagnosis, despite of everything, all these things, the diagnosis is predominantly clinical. Early signs can be settled, but no specific medical test is there that you do and you get. It's just based on observation that how the child is behaving, communicating. Based on this, there is a rating, and based on the scores we give. But there is, when it boils down to which children should receive treatment. So there is nothing like a score. Which children should receive treatment? It's like which child should go to a tuition class. So any child who is intelligent also goes to a tuition class. Any child who is Buddhu also goes to a tuition class, because every parent wants their child to perform, to improve. So in short, whenever we think that the child has anything which has to be intervened or is not up to mark, we should try and improve it. Now improvement can be in terms of the communication is not up to date or the child's behavior is not up to date. We may label, we may not label. But what we should definitely know that we should intervene and we should start concentrating on the region which the child is not doing properly. So diagnosis, outside they use ages and stages questionnaire. Well, MChat is a very easily available tool which is a questionnaire form of thing and helps diagnosing most of the autistic kids. AIMS has modified this tool with for DSM-5 criteria, and it has come with an app for the same, in which you have to answer the questions, which have also some demonstrations which help in better diagnosis and better scoring of the system. Treatment is not a single person job, even though we are trying to see that the parents should be able to do it, but it was really going to be a difficult job for parents to sit at home and do all these things. What we want to really do is that we want to help them bridge the gap. That cannot be done to a full extent, but we can try to a significant extent in doing so. And if all the strings lie eventually in the hands of parents, because nowadays no one is really gonna come, or the parents are not, they will not be able to send the children with the same what they were doing in the pre-COVID region. Other things like medications, education, behavior, dietary treatments are still to be continued. So therapy and intensive and early intervention definitely helps in improvement. So home therapy is now what we will be more concentrating on because of the current prevailing conditions. So different types of therapy, ABA, speech, occupational, but we have to understand all this therapy aims at improving the performance in terms of its social domain, in terms of its communication domain. So normally what was initially, the patient used to go to a doctor, a therapist, a developmental neurologist. They used to see what's wrong with the patient. We used to assess, we used to see what it could be. A plan was devised. Later on, then because of all these therapy sessions getting disrupted because of COVID-19, there are lots of dropouts. The parents are not being able to provide the same equal attention at home. And this has resulted in huge number of behavioral disorders popping off in these children, lots of disruptive behavior, sitting, spitting. So lack of access, need to go to clinics, and everything has been disrupted currently. Daily routines have been disrupted, which is a major. So routine is a major part of autistic child. So when you disrupt the routine, his mood changes. So they are frustrated, short-tempered, and then the current situation, hygienic practices, as everything is running. So the life is all around only three main aspects nowadays. It's wear a face mask, maintain a social distance, and wash your hand. Almost all other things have taken a back step because these three things have almost dominated life of everyone, and implementing these three things in an autistic kid is an equally big challenge. So it's very difficult to implement these main three things in an autistic child because all of these have sensory issues coming up. So what can we do to make them stabilize, to because we have to live with this COVID for next maybe 6 months. COVID is going to be with us, and almost everyone at some point will have to say that, well, I accept this to be a background and I continue on with my life as before, or maybe I can try. So what parents can do at home, prompt cards, they have to move around stories, because the children has to understand, the child has to understand that whatever is going on has to be implemented. So they have to move on with stories, comic strip conversions, whatever. They have to try and build up the skills from the children, and whatever the behavior is there, try and maintain a calm, use more and more positive reinforcement, praise them more, so that you get what behavior you have and you suppress the behavior which you don't want. So prompt cards like stop, wait, where the children are don't really communicate. So there are board game rules when they play. So for Zoom, basically with the children who are doing online consulting, when the parents are doing online consulting, older children who have some schooling in form of online, so you have to make them cards, you have to make them understand, well, this is the thing that you have to do. You have to make them used to this computer screen, because that's what going to be a future for at least coming 6 months. So for hand washing, you have to make stories that why we need to hand wash, where we need to hand wash, how do we have to do. So hands getting dirty, toys are dirty. When you touch your toys, when you go outside, you have to wash the hands. So this doing all these things will decrease the anxiety in a child, will decrease the fear of moving on to something new, and that will help him more compliance with the things which we want. Similarly, with social distancing, you have to explain them that, well, whenever we are going out, speaking to someone, we have to maintain a specific type of relation, because this is what going to be a norm. When you have to live, this is what is going to be a norm. Same way for mask, all the toys. So what they're using, that the toys at the home are given masks. So we are explaining them, we are playing with masks so that they get used to things, because while putting a mask, most of the children already they have their behavior things. So breathing difficulties, some of them are experiencing, some of them don't like the feel the way mask is there. So we have to explain them, we have to create a structure for them. We have to make them feel that this is a school time, this is a therapy time. At therapy place, they know, well, I go in this specific room, I have this specific teacher, I have to behave myself, I have to behave as they are explaining. But at home, you have to mimic whatever is there to the best possible situation, so that you can extract maximum possible maximum possible cooperation from the kid, and you can do better with it. So daily routine, make it as consistent as possible. Music is helping in a huge way. Get plenty of exercise, try and do yoga, try and improve the interaction with family and friends. Don't keep the kids alone, because as madam has explained, even we as a doctors are thinking twice before hugging our kids, before cuddling them, because we feel that maybe if I get infected because of my exposure outside, I don't want my children to get infected. But we have to still maintain a family relation, because these kids don't have anyone with them. We at least can manage our own wishes, our own behaviors, but these kids want someone so that whom they can depend on, whom they can incline on. So have some quiet time so that this can decrease your inner urge to move. Most of the kids are coming with demands try and limit them so that you should not disturb routine tantrums, or these may increase the routine tantrums. Talk to them about COVID-19 because, as I said, everyone should know what's going on there. Telemedicine is coming in a huge way at this point because lot of research is coming in telemedicine nowadays. Even doctors are doing consulting online, and it's been quite, means you can have their prescription sent online. You can get the temperature, the patient can put in their temperature, and many things are, so it's revolutionizing the way one is treating in medical. It's a good form of maintaining a social.
Okay, so going.
It's a good form of maintaining a social distance. And with ASD, because the therapy has to go on, the show has to go on, so there has to be something that the parents have to be taught to be done on daily basis. So technology is definitely making a but we have to always see that technology is not mobile. So you don't always give mobile in the hands of kids and say, well, learn from this and keep on continuing whatever you are seeing, because more of a screen time is also equally harmful to the kids. And you have to see that it should be interactive screen time, and the screen, whatever is going on, the child should understand it, and we have to be a medium inside. So there are lots of assistive technologies that are coming on for autism, like artificial intelligence is coming on. So there are iPads, wearables, mobiles, there are gadgets that are coming on. But with the onset of mobile, the most of the apps. So apps are almost for everything. For routine people, it's right from seeing your blood pressure, walking steps, to it has come in each and any possible way. So this is a pediatric neuro AIDS diagnostic, as I had explained. So this is the app that is freely available on Google. It helps in getting a diagnostic test. You get a score, and with which you can go to your physician and confirm that whether these are the features and what further can be done. So it has been validated with MChat for Indian population. Second one is this autism treatment evaluation checklist. So it tests like 4 things: speech, language, communication, sociability, sensory cognitive awareness, other behavior things. It gives a subscale score as well as a total score. This helps in finding which domain the child is especially worse with, more affected with. It gives a score which you can pay more attention to the things that are required. Then Autism AI is the app which utilizes artificial intelligence to get a report of the patient for diagnosis. So easy to use and accurate screening platform. So there are behavior indicators in this, with the help of which we can get onto a significant diagnosis. So this is an autism early intervention app in which there are lots of things like activities, study things, there are worksheets with the help of which we can help in modifying the behavior. We can carry on some form of therapy at home. So there are lots of visual clues that are presented by this app. So you can manage sensory overload. So we can, because it's always give the same form of instruction, so it's quite predictable. So there are verbal clues that are being given. So Avaz App is developed in India and South India. This is basically optimized for 7 different Indian languages, which helps as a voice for children with autism. So most of the autistic children who are not able to communicate, with the help of Avaz App, they are able to tell on their needs. So there are lots of cards, there are lots of symbols and images with the help of which they can speak on what's in their mind, and that can help in communication process and bridging the gap. So Autism Aid App, this is primarily, it was made for in Ghana and West Africa, but the picture exchange communication system is quite good with this app, which can help the children. Autism Help. So Autism Help is primary to carry on day-to-day activities, to prompt children in carrying on day-to-day activities like taking a shower, drinking water. It can help them how to move on and learn their activities of daily life. So Autism Diary is for meal and their specific intolerances. So whatever you feed the child, whatever the child is eating, you can maintain a diet diary of the kid. But the thing is that all these apps, they have some significant limitations in form of all of them deal with a specific field. Some are only diagnostic, some are used for intervention, some are used for speech, but then nothing has been able to come which can tackle all these three aspects. And with the initiative of Dr. Manu Kohli and from Government of India, we are out with the app like Cognable, which deals with all these three aspects and where we can help our children more. So it's under an Indian Innovation Growth Program. So there are lots of Tata Trust funding, initiative, support with which we can get on to a good support system and help the child in getting a therapy at home and improve daily needs. So initially what we used to do in therapy sessions at the therapy center is not possible nowadays. So we have to move on to something more better that can cater to our child needs. So in this, we develop a program which is individualized to a child by assessing in conditions, the doctors interact, the therapist interact, and for a kid, a specific plan is devised. The performance of kid is recorded and then it's modified accordingly to help into a proper therapy that can be given to children in the coming days. So patient is there, it interacts with the doctor, it interacts with the therapist, a plan is devised, then subsequently with the help of the app, we find a platform where we can move on with our updates to the patient can move on with the therapy, a consistable follow-up is left, and then we are able to move on to a new treatment based or a new style of treating these kids with autism, which can help them in the long run. Well, thank you. Any questions?
Thank you very much, sir. We'll take the question after Mr. Manu's session.
Fair enough.
You may stop sharing the screen, sir. And I'll invite Mr. Manu to come and talk about cognitive.
Sure. So thank you, Dr. Amit and Dr. Ranjana for such enriching session and allowing me to be a part of this platform to share my views and share about Cognable as well. So I just want to say that the Cognable is something that we built, has been building from last 2 years, 2.5 years, and we never thought that COVID would come and suddenly Cognable will make things kind of needed in the market. But we have been working on it from last few years, and the objective was because it comes from our experience, my experience also as a father of a child on autism, where my son was diagnosed around 13-14 years back, and I could see we moved from pillar to post in India and abroad in US as well before we equipped ourselves to probably build skills to handle the child, because autism is more like a marathon journey. It is not like a sprint that we can do a 100-meter sprint and win. It's a marathon. You need to learn, you need to continue to do, and you need a partner which can bring you accessibility, affordability in that journey as well. And that's how we started building Cognable on. So, we decide based on the concepts. One was the capacity constraint, bringing in affordability, reach and scale and quality. And the complete app is devised on that, overcoming these 4 models. So it allows, what we are doing is we have been running clinical trials with few government hospitals as well on autism screening, which is with the Safdarjung Hospital in New Delhi and Maulana Azad Medical College in Delhi, and we have developed a technology framework which we already published in a very renowned peer review journal and artificial intelligence conference as well. But the clinical validation of our screening platform is still few months away, but we are collecting data for it, and it's free of charge that we are offering our parents to be the part of our project, at least on the autism screening side, and they can participate with us on our clinical trials It is a totally non-invasive clinical trial in which we ask them certain questions and ask them to share a video, and it allows us to build a home screening program for them. The logic is very simple, as autism is totally behavioral. What we are doing is measuring the behavioral skills of the child from the video. So like in this video, you would see there are multiple responses that the child is performing on the video, but a good pediatrician or an excellent pediatrician like you, who has a number of years of experience, are probably very limited in our country. So what we are doing is we are giving that training of identification of the behavioral markers on those videos to an artificial intelligence model, so that it can pick up those cues or elicit. We ask parents to play with the child and elicit skills that a child with autism usually have, and record that session. And that session of recording is then fed into an AI model, which actually the technology we have is kind of very mature, and it does kind of analysis of that video and shares the results. So just quickly, I'll go offshoot is this is our work we recently published as part of IIT Delhi work, and this is already available in a public domain. So this is something we are augmenting on with our clinical trials, which is a human action recognition model with a very innovative approach through which we can perform the autism screening. Coming back to our work here, so this is on the autism screening side. I just wanted to share that anyone who wants to participate with us in this clinical trials is most welcome. This is running as part of Maulana Azad Medical College as well. The second part is a remote intervention, which we have shared. I will share the app with you, which is available in English, Marathi, Hindi, and multiple other languages as well, especially for parents. It's an app which is not for a child. It is an app for a parent, so that parent can actually build skills of a child sitting in home with a very personalized plan that is available for the child as per the need of the child. And what it does, especially in these times in COVID-19, is that you cannot have a physical center or therapy center that may run, but we allow on our app for a clinic to build their clinic, virtual clinic, onto the app, and build in their therapist and the parents who are part of that clinic virtually onto the app. So, and then the app has a complete assessment integrated therapy recommendation model that has already been built. So for example, I can show you this is a web app for our work. I will show you a mobile app as well in well education that are there, and each of the curriculum has a list of targets and hierarchy setting in which we need to teach a skill to a child in certain way. It also has behavior management program and language development skills in multiple areas like binding, imitation, echoic, visual perception, receptive language, and so many. So there are like 800, 900 targets that are built with a standard protocol and a training videos that a parent can run it at home. What a clinic usually do is they go into a program, they perform certain assessments, and these assessments are very evidence-based assessments which have a lot of published literature behind them. These have been licensed from the US and been adapted to an Indian condition. So VB-MAP is, for example, one which if a parent can be done, and it does an evaluation of child's milestones, transition, task analysis, barriers on behaviors, and it recommends automatically based on assessment a recommendation plan that a parent can use it at home. Especially you have a lot of other things that a parent can record, what a child eats, what he's asking every day, his medical condition. So it's more like an electronic therapy records we are capturing for a child on a daily basis. And we, over this data that we pick up from the child, we see a correlation between, for example, what the child eats, how his medical condition is, what medicines he is taking, his toilet data, and the certain behaviors he may be displaying. So there's a lot of correlation analysis we can do with this data in the background. In addition to this, we build, for a child, a lot of long-term, short-term goals. So let's say, if you have a child here, I can build complete long-term, short-term goals and all the targets. So, for example, this is a kid for which we have built a long-term, short-term goal in terms of using a complete sentence, 4 to 5 singular words, advanced language school, where WH questions, which is like where, when, why questions, the concept of coins and currencies, reciprocal conversation, concept of seasoning. And then, you have an option to create, use multiple languages. So you can do it in Bangla, you can do it in Marathi as well, you can do it in Hindi. So, you can do whatever you want into the app. And there is a curriculum and a recommendation that comes from the library that allows you to build that with a click of a button. So even if a staff, has an assessment, standardized assessment done, the recommendation or the follow-up of the program can be done very, very quickly with certain clicks of button to make that plan very, very individualized for the child. So let me go through the app from a parent perspective and show you how it looks like, a mobile app. So I'll just use another Zoom to share my. So this is a mobile app that is there. I can just have had the user already there. So you can do multiple things from here. You can do autism. So right now the language what I have fed is Marathi. You have multiple languages from the profile section that you can do. So you can have Marathi, Hindi, English, whatever you want to. And this is the interface for a parent. This is not an interface for a clinic because the clinic has a little bit more advanced interface and multiple kids and multiple staff to manage, and the staff has other additions, for example their work log, the children allocation, the revision goals, etc. in place, which is there. This is more like for a parent, so we try to make it very easy. A parent can participate. If he's participating in our research, he can participate through autism screening. For the autism therapy, he can definitely click on autism therapy, and then if the app takes him to a page where it shows that what is for a parent to do at today's day. So there are multiple sessions that we build for a parent that they should be working with a child, for example, in morning, afternoon, or evening, and we do it based on our consultation with the parent. We don't overwhelm them with too much of work, but we kind of discuss with them how much time they have, who else can in the family participate in the therapeutic process. So, for example, if the grandparents or the siblings are there, can they spend 40 minutes of time with a child in a very structured environment in which we want them to go in and spend some time? And then based on that, this program is made. So it says that this will be done by father, this can be done by mother, or whatever. Here you have multiple things like you can enter your food data, your man data, your medical data, your toilet data. All those things you can enter it here. If the child is going for is able to do everything by himself. For example, if he's using toilet, you can record that. Or if he needs some help, you can record that and put that into the system. So we understand where the child is. This is the toilet data. You can have the medical data, a lot of things about what food he is eating, what is the quality of food, the notes. If he is taking any drugs, etc., you can put all that details. So this is more like the daily vitals data that a child is supposed to be monitoring. We can monitor him on. The therapeutic data is more like here, which we build a sessions for the target for the child, and there are multiple things. It can be in any language that we can build. So there are skills like appropriate word, one-step instruction, correct item from an array of 3. Receptively identify color. So these are the skills that we are trying to teach to a child, and a parent can start a session. It tells them what instructions the parent needs to follow, and then you can click on start the session, and it takes you to a screen where the details are present. So for example, now it says that writes the appropriate word after hearing it. A parent can simply click on this and you will see the instructions on how to do that. It's clearly written on how they should be doing or teaching that skill to a child by following the set of instructions. And these instructions are developed by behavior analysts, who are qualified to do this task. And they have been, they can be adapted when I build the plan for the child as per the need of the child by slightly changing things here and there. And then you have a videos that talks about how to run this skill as well. And you have multiple targets that are there. So you see receptively identify colors. So these are the skills on how the child should be able to identify the colors. It's written. Start the session by placing the picture of a card of different colors in front of the learner. Start with a small array. Make sure the learner scans all that item. Ask the learner, show me. And then, there are prompt and prompt rate techniques that are being listed here. Parent can simply do correct response if the child does correctly, or if he needs any help, they can click on incorrect response, and the app asks what kind of help are you giving him. So you give him a verbal cue, so it records that. And then, you can do whatever you want. You can move to the next target. So the objective is that this data we really use, in on a very objective way in the background to further personalize the plan for the child. How many correct responses, how many incorrect responses. If I now want to teach a child from a receptive to an expressive language, when is the right time for me to move him there? Does he have the skills to be attending a classroom in an inclusive school, or he still needs prerequisite skills to be built before he can attend a classroom? In the lockdown period, what are the skills which we can teach him to actually maximize his learning gain across language, across minimize the behaviors and things like that. So, these are multiple targets that are there. Let me show you some of the targets which are, available in local languages as well. Yeah, so these are something we have built in, Marathi as well. This is one is in Hindi, this is in Marathi, and then the instructions here come in Marathi language as well. So how to do that, and we have certain staff here with us in who speaks local languages. So the lesson plans translation in a most colloquial form can be done. So for example, here we are asking a child to teach, 10 imitation skills. So, there are 4 skills that we are trying to teach here. Clap hands. He should be able to touch his nose when, if the therapist is doing that. Another one is arms up. So these are the skills imitation skills that we are trying to teach. The target is imitation skills, but the specific imitations that we are trying to teach to a child are, one of these. And you can record your responses against each of them. For example, he did correct. Or, in the next one, he didn't do it correct. So you can do everything. So this is a very powerful data for us to analysis. And, for a parent, we really don't ask them to fill this data, but if they fill, it's really useful. But we try to see how much time a parent is spending on each of the target, his behavior across the usage of the app to kind of still go ahead and do a personalization for the plans for the doctor. So, this is something, that the plan does. It has, the app has a lot of other stuff as well. For example, right, like it has a lot of graphs and reports that it generates. I think these are in the clinic login, and we will be bringing them into the parent login as well. But it has a lot of graphs and reports which shows that how much time a child is taking to learn our target, how much target he has in a particular area or domain of his learning, and what next should be coming for him to learn. So this is kind of a recommendation things that keeps coming in from the app. And it reminds the parents to work with a child in number of days, in number of times in a day. For example, you have certain notifications here, and this notification, tells parents that they need to work with a child in the morning, afternoon, and evening. There are certain reminders of things about if the parent is not recording the session and not starting the session, it sends a reminder for a parent. So a parent is motivated at least to work with the child. Then we offer them a lot of informative stuff in terms of communities and blogs here, where a parent can come and talk about his behavior, consultations, what problems he is facing, so that there is another parent who can guide it, or our therapist can help them into the journey as well. There is a dedicated case manager involved here, which shows that what kind of support a parent can get from the case manager, and there is a chat functionality here to directly communicate with the case manager on the issues that the therapist is facing or the child is facing. So they can easily communicate and resolve the issues on an immediate basis as well. They can touch base with us. So there are they can call us online with our chat support system. It has certain FAQs that a parent can consult, and the other resources that are available as well. So this is more like a parent interface, which is available on therapy side and the autism screening side as well. So this is more like an overview of the app in a very high level, very quick level in 10 to 15 minutes.
Manu, can you connect more like how the parents are going to use it and how the doctors and the therapy centers are part of it?
Yeah, sure.
Yeah.
So let's come. How does parent, how does a parent or a doctor become part of it? So the first thing is, for example, what you see here is a clinic that is created for a clinician. In a clinician, you have number of what we do is we create
the other screen is there. You have to remove this screen.
Just a minute. Is it visible now?
Yeah.
Okay, so what we do is we create a clinic. That clinic is for a pediatrician or for a practitioner, and in that clinic, what can happen is a clinic can create the learners or the children in the system, like what we are seeing right now are number of children, and they can also create their staff, like so that is the first and second. So you can create a learner and you can create a staff in the system. Then what happens is once the parent comes into the system, the clinic staff will perform certain assessment, and we have multiple assessments that a clinician can do for a parent. They can click here. They can perform multiple assessments that are part of it, and these are all evidence-based assessments. They're all digital assessments that can happen. They can talk to with the parent on a phone. There are functionalities like calendar functionalities, etc., that can be part of it. For example, you can build appointments in the system so that everyone knows when they are meeting next. Once the appointment is done, a therapist and a parent can talk to each other remotely. These digital assessments can be run digitally through the distance, or some of the assessment, for example, our cognable assessment and certain other preference assessment can be done by the parent as well, as they are very easily drafted for us to for them to be filled. Once they fill up, parent, the therapist gets the idea what is the level of the child, and a consultation or the discussion happens between the therapist and a parent, that what are the priorities for the parent for a child, for the things that needs to be taught to a child. So it may be for some kids, it may be some parents, it may be academic. For some kids, it will be behavior. For someone, it will be language, or some it will be a basic requesting or a one-step instruction that needs to be taught. So based on the assessment, these outcomes are shared. Therapist shares the recommendation, but ultimately the parent is the one who takes a call. And based on that, a long-term goal, short-term goal is built in the system, and this is being agreed with the child. That these are the long-term, short-term goals, that are built. These are the typical long-term, short-term goals done, and these are done with the consultation of the parent. And for each, goal, there is a long-term goal, there is a short-term goal, and inside the short-term goal, you have list of skills that we want to teach to a child that are allocated, and each skill has the protocol that comes from our library automatically, that how this should be taught and what are the steps for it to be taught. So this also comes. There is a video link that is also there, which comes from the library most of the times, which suggests that this skill needs to be taught to a parent through a video model, and this is how it is. As soon as it is done now, the pediatrician will start seeing, what program the child has been allocated by simple, clicking on this graphs. So these are the graphs which says that, okay, you can see that, okay, now, the kid has so many programs or the targets or the skills that need to be learned by the child. It has Manding 5, Echoix 2, academic to imitation 10. So these are the skills that been being needs to be taught to the child. And what has been mastered in last few days can also be seen, so that the complete visibility is there. So you can see what's been mastered, how many days it is taking for a child to master those skills. All those skills are can be seen by the pediatrician. So even remotely you have a lot of graphical reports to see that how the child is progressing. And for a parent, the parent sees a daily schedule on how he needs to work with the child, and a daily curriculum or the daily program that are very specific to the child on how they needs to be run. They just run those programs, and based on the data that is recorded every day, the progress is getting updated on a daily basis and can be seen by the clinic on everyday basis. And there is a chat mechanism in place through which a chat or a discussion can happen between a therapist or a case manager and a parent to sort out any issues. So a child acquires the skills on a regular basis. These skills may be in the area of language, in the area of behavior, in the area of academics, or in the area of the activity of daily livings on which the program is made, and that comes as part of the curriculum that we have built over last 2 years. So these are the multiple skills that a child is able to use. We currently have almost like 50 users on using the app on a daily basis. These are from India and abroad as well. And we really feel that the app is significantly creating a positive in bringing updating the skills of the children in this COVID-19 times. And we'll be happy to share the data across with you if that is needed as well.
Thank you. No.
So I'll be happy to answer more questions around this. But
can you off the slides?
Should I stop the sharing?
Yes.
Yes.
Okay. How do I do that?
So thank you so much, Manu, for the detailed presentation on Cognable, and Ma'am Anjana ma'am, and Dr. Amit. And I believe the other guest, if you have any questions, please, we can start the question answer session. And as an initiative, like we are a global nutrition company, WEFA, and the whole objective is in India to work on the domain of pediatric segment, and our focus is nootropics. And Cognable is one of the tools which I believe is going to impact a lot, and a lot of evidence, a lot of support from the government of India as well as from different other societies are coming up. And we are also going to share some of the contact number out here. Like anybody is looking forward for any future presentation or interaction, that can be done. Now I believe we can go ahead with the QA. So there is a question coming from Ruchi somebody, and she's asking, children with ASD tend to have affinity towards certain people. What is the reason behind it? So I would request Dr. Anjana ma'am or Dr. Amit to address this.
Okay. See, we have to understand that they have very typical fixations. Okay. I mean, for all the audience who would probably not know that autism, before the term was coined, it was called as childhood OCD. Okay. So because of this obsessive compulsive behaviors which these children have, and they have these certain fixations, it's like heightened interest in a particular object, in a particular type of person. So whatever they want in a certain routine manner. And so I'll give you a simple example here. Now there is this one particular child who wanted, to be pacified by a particular uncle only. So staying with the joint family, one particular person can only pacify the child at night, while the food has to be given by another person. So they have these fixations. That's why they're problem with transitions. They're children who show very clear gender affinity as well. You know, so those are the other affinities which you would see. So this is again part of that. See, you have to understand autism that their cognition is different. The way they look at the world is different. The way they understand the world is different. Okay, there's nothing wrong with these children. Now, this repetitive behavior or echolalias and all the motor stereotypies is just an expression because they understand and they respond to the world differently. So this is something which is very commonly done. However, with therapy, with behavior modification, with ABAs, we can work on these behaviors definitely. And over a period of time, one, they change, and second, they may become lesser. However, there are certain ways of cutting the cost. Yeah. Any other question we have?
Yeah, is there any other question? Maybe you can post it on the chat box, or you can open your, you can simply unmute and ask.
You could ask any question pertaining to your child if you're a parent or if you're worried about some future or whatever, about a child's thing you could ask.
Hi, Anurag this side from Jaipur.
Yeah.
Video, whatever videos are there, those are very good videos. And those are, I think, the strength of cognable. And is it visible to teacher or therapist also now? Earlier it was not there. So now is it visible to them also?
Yeah, sorry, Anurag, can you say it one more time?
Yeah, the videos which are there in Cognable app, those are very good videos. It is visible to parents, but it was not visible to therapists.
Okay. Yeah, it is visible now. So what we are doing is every week we update the app with new features and new functionalities. So if your question is on the training modules that we have, ABA training modules that are part of only the only the parent curriculum, are they available to the therapist and the clinic as well? So they are right now.
Okay, thank you. And second question, which may be relevant to our structure, is how can we see attendance and how much time the therapist has worked with throughout the day, or maybe in a month or 15 days. Can we have this kind of facility here in app?
Okay. Okay, this is a very specific question, but let me try to answer that in a very general way. I think as Dr. Amit Vatkar said that the telehealth or the technology component, especially in this COVID times, has grown more than probably what we thought it could, right? So the COVID-19 has become more like a driver for technology incorporation in the field of medicine and health. And I think for our children who are on special needs, I think we should look at it as a big change, especially happening in India, where the doctors are and the clinicians are not so many as what we demand, and the affordability and the accessibility of the services is really a challenge. So let's say a clinic or a doctor in current time, or a therapist, or a practitioner who was working with the children with autism before, could see that a children is coming to that particular clinic or into the OPD, but it goes the patient or that kid goes back with a kind of a one-time program, and the contact between the doctor and that kid is lost after that. But with Cognable app, it happens now that the connection between the doctor and the patient is there. It more becomes like a digital app or a digital pill that is recommended to a patient or to a parent to kind of use it on a regular basis. And then what the app also does is it does allows you to maintain your staff, in a very constructive way. For example, you can see how much time the staff has on a daily basis. For example, 8 hours. What is his allocation across with number of kids? What is the review system that is coming from the patients, on that particular staff? For example, what is the star rating of that particular consultation or appointments that is happening? So you can have a very data-centric approach on how your staff has been doing with the patients and with the parents, and what is the quality of intervention that a parent is receiving.
Yeah. So it is visible to clinic. That means now we can see in the app or maybe in our web access to Cognitive app.
Yeah.
Okay.
The question we have about does the health in case of autism? Which we say that all these supplements are like form of boosters. They are not really they are the health experience actually transform autism to autistic more cognitive or better. But you see that all these things help in improving the outcome to some extent. And some may not get about it. In most of the cases, they have shown to be giving some positive results. So, we understand that you and maybe yes, then maybe you can give it, but it's not so significant, then the drug check going on. That's another question.
Sir, I believe a lot of echo happened.
Yeah, we couldn't get the answer correct. So I don't mind just rephrasing. I think whatever you said is that it does have a certain role in, synaptic. Still a lot of echo, no?
Yeah, your voice is cracking.
Cracking with a lot of echo.
Yeah. Ma'am, we can hear you.
Yeah, so see, L-carnosine, one, it has a certain role, at least the studies say that in synaptogenesis and regulation, but in practical use now, we've been using it since a while, in the market, it's available before Cognicare, Cogni3, Cognicare, there have been different brands which are available. What we see is that it does help to some extent calm them down, maybe at some level at cognition, but with autism, it's a little difficult to say, that what cognition, I mean, you can't really have an evidence because you're not stopping the therapies. You're working on the therapies, you're working on all the other modalities and also giving, but one, it is not harmful. It is somewhere, there's evidence that it has been useful. Okay, so I mean, I would rather give it for around 3 to 6 months as a supportive treatment. Or could we just, otherwise?
No, sir, it is still cracking and there is echo.
Yeah. So can we conclude the session? I think that's what Dr. Vatkar is trying to
Yes,
say.
yes.
Right.
Okay. So thank you very much, ma'am, and sir as well. So we will conclude the session. Thank you very much for all the attendees. If you have any queries, you can ask us. I'm just posting the number over here. So it's 9833 5270 and 55. Here you can reach out even if you want cognitive demo. So everyone can reach out here. And I would just request everyone to join the Facebook community group. The link is given in the chat window. And it's all right to be different group where we are gathering doctors, therapists, psychologists, parents. So we are creating a platform where people come and interact more than just a consultation at times. So this is what the overall initiative is. So please join in and be little free to interact more. And thank you very much for your time today. Thank you, ma'am.
Thank you.
Okay, thank you.
So we are concluding here and we'll connect again in the future. Thank you.
Thank you so much, ma'am.
Thank you. You're most welcome.
Thank you, all of you.
Thank you, Vatkar sir, and thank you, Manu sir as well.
Thank you, everyone.